What are clinical trial endpoints? Meaning versus statistical significance. Imagine you're trying to find out if a new medicine really helps people feel better or live longer. How do researchers decide if the treatment works? That's where endpoints come into play. Endpoints are specific results or events that scientists measure to see if a treatment makes a difference. They could be things like how long a patient survives, how much their symptoms improve, or how quickly a disease gets worse. These are called clinical endpoints because they directly relate to health outcomes. Sometimes, researchers use surrogate endpoints, which are indirect signs like tumor shrinkage. These can give hints about the real benefit but are not the actual health outcome. The main goal of a trial is to see if the treatment improves these endpoints compared to a placebo or standard care. Endpoints are usually classified as primary or secondary. The primary endpoint is the main thing the trial aims to measure, like overall survival in cancer studies. Secondary endpoints are additional effects, like quality of life or side effects, that support the main findings. Now, understanding what an endpoint means is different from knowing if the results are statistically significant. The meaning of an endpoint is about what the result shows. Does the treatment help? For example, if patients live longer, that is a meaningful endpoint. Statistical significance, however, is a mathematical way to tell if the difference observed is likely due to the treatment and not just chance. When a result is statistically significant, it means the data strongly suggest the treatment truly had an effect. This is usually expressed with a p-value, where a value less than 0.05 indicates significance. For patients, this distinction is important. A treatment might show a benefit, but if it is not statistically significant, we can't be sure the effect is real. Conversely, a statistically significant result on a surrogate endpoint, like tumor size, might not always mean patients will live longer or feel better. So, when looking into trials, ask what the main endpoint is and whether the results are statistically significant. If the primary endpoint is overall survival and the results are statistically significant, that suggests the treatment could genuinely help patients live longer. If the trial uses surrogate markers, check how well those markers predict real health benefits. Also, review secondary endpoints to see additional effects the treatment might have. This way, you can better understand what the trial results truly mean and make more informed decisions about participating or choosing treatments. Remember, the goal is to find treatments that offer real benefits, and understanding endpoints and their significance helps you see whether the evidence supports that.